Hey guys, it's me, Film Series 5. Welcome back. Please remember to give this video a big thumbs up and to subscribe and to ring the bell to be notified whenever I upload. And I hope you enjoyed today's video, and I'll see you guys in the outro. Bye! Good evening, Dr. Bhatt and Dr. Wei. Thank you for pulling out some time to do this interview with me. So I wanted to do this interview to give people a sense who may not live in the US or who may just have a lack of understanding of the whole medical perspective of the current COVID-19 pandemic. So what I wanted to ask you first is, as a doctor in the United States, how do you feel your country has responded to the current pandemic?
Good morning, Shiv. It's a pleasure to do this interview for you. My standpoint, the government has tried to collectively take action in terms of have the CDC director, Dr. Anthony Fauci, on the front line to help guide with the community response and guidelines.
Yes.
They have given funds and finances to the state government to help deal with the situation. Individually, for businesses and stuff, they have done personal payment plans and certain financial programs have been set up to help people during these tough times. However, overall, being in the field of medicine and just in general, looking at the responses of other countries, I feel our government has lagged behind in a lot of things that they could have done firsthand when they had the information available to them.
Yes.
I think they could have been better prepared in terms of helping the hospital set up for dealing with such pandemic. I feel that in general they were not prepared for this pandemic. This is new for everyone, of course, but as you know, pandemics happen every 10 years. And so every country has its own planning of being prepared for the pandemics. I feel this government was not ready for that. And as a result, you see the consequences by certain states here in the United States having suffered a lot and a lot of lives lost. That is my opinion.
So, looking at how it all started, I think we had enough lead time to prepare for this pandemic. But of course, America being a capitalist country, it's not easy to shut down all the businesses and say, stay home. So I think the government got caught between this situation. Of course, if they were well prepared and if the president and the government would have fought against this as a united front, including both sides of the aisle, it would have been a better show of force rather than trying to politicize this whole situation. It has happened in other countries too, but I think at the end of the day, all countries have to fight as one because this virus doesn't differentiate between color, caste, creed, etc.,
Yes.
rich or poor. Of course, eventually more data will come out as to who are affected more than the others. But in general, I think whenever a country is faced with such a big disaster, they should fight as a countryman rather than a particular political party. And being the president and being in the government, doesn't matter who it is a thankless job. If you do this, you'll be blamed. If you do that, you'll be blamed.
Yes.
But there are certain things which were done by the current administration, which made us a little bit lame to fight this major disaster which hit us. Of course, comparing it to previous pandemics and the annual flu, we are seeing lesser deaths so far, but that is because we are all staying at home. Eventually, all data will come out as to what is the real mortality rate compared to flu and this one. And that way we will be able to better prepare ourselves and fight in the future.
What changes do you believe will come out of the medical profession after COVID-19 has passed?
Well, I think first and foremost, people like in New York City, physicians and healthcare workers, even the first line responders who have worked in such horrific conditions, the first challenge is the post traumatic stress disorder that people are going to face after this. So, in the long run, the change that I see is preparing for this pandemic. They will have to take this seriously and have a special kind of office or department or whatever body that creates a plan for future pandemics and how to deal with it. To be equipped with better resources, to have better personal protective equipment, because currently the reason a lot of chaos happened there, as we know of, one most important thing was the lack of personal protective equipment for them. And so I think better planning for a pandemic in the future. Another thing is this led to the development of telemedicine or telehealth. So, as I am a primary care provider, I have my patients. Patients do get sick. I have never ever taken care of patients without examining them. However, in this situation, I had to make that choice because bringing them in the clinic would make their chance of exposure high. And so we collectively, like as the government also started recommending this, started doing telehealth. And so on FaceTime or Google Duo or other telehealth applications, we are talking to patients where they call from their own home, and we come up with with the plan to take care of them or help them and treat them. I think this is going to develop, and so that more and more people can be reached. Specifically, a psychiatric field can develop this way, where a lot of psychiatric disorders can be dealt with, where you can reach your psychiatrist via telehealth. So that's another field which is going to develop after this. So that's my take on it. I don't know. Do you want to add something to it?
Same question. I think we need to develop a better tracking system of all the countries, countries which face this situation. South Korea did very well, and it was because of tracking and isolation. So I'm thinking a task force with a tracking team which arrives at a particular location in the country as soon as the first cases hit would be a better way to do it. South Africa also, did I say South Korea first? So South Korea was the first one. South Africa did an awesome job in preventing the spread because they had a lot of people on the field, which they used to use for tracking HIV. In America, being an advanced country, there was not enough staff, like what we call social workers on the field, to track patients down. And I think that was a major downfall. And of course, nobody can be prepared. So I wouldn't blame anybody, but a lot of lessons to be learned from this whole situation. And I would say, let's say Washington got hit first, isolate them, provide them with enough assistance, track them down, test them, and hopefully keep an infection isolated. Thankfully, we live on the Western Hemisphere, and most of these transmissible diseases start from the eastern side, and it takes a while for it to arrive here. So I think we have enough lead time to kind of keep ourselves prepared, which unfortunately was not done because everybody feels like they are protected in one way, shape, or form until it hits them, and hits them bad, and some people even lose their lives. So I would say enough of preventive medicine should be taken into account to help the community, would be one way of thinking. Telemedicine, in a way, is a good development, but at the same time, it can create some issues too, where physicians will be expected to see more patients with telemedicine, which can lead to some loss of jobs and stuff like that. Um, Telemedicine does help in the interim. It's a band-aid, but not everybody has cameras and stuff like that, so we do it by
Yes.
phones. The cameras, reception, and everything, and of course, touching the patient in person and physically examining them cannot be replaced by technology. So it could be a good interim measure, but I'm hoping it's not going to be a permanent thing, because then it all becomes like robotic kind of stuff, and losing the art of medicine, what we were taught when we were in med school, might get lost. Everything has become numbers, and how many did we see, and what is the income level, and that's what it has all boiled down to, rather than trying to help the patient out in a complete manner.
So I'm going to switch to a more political question. So, looking at the situation, do you believe that President Trump could have a chance of re-election with the steps the U.S. has taken and with all the statements they have said as a government?
I think President Trump has done well economically so far until this thing hit, and it wouldn't have mattered which president would have been at the helm of the country, would have had this situation. Historically, it has been seen that elections are won or lost based on how the stock market is doing at that time. If the
Yes.
election is held right now, he might lose it, but people might give him the benefit of doubt that this was not under his control. But I think the elections are in November, and we are almost 6 months away. And by that time,
Yes.
if the stock market bounces back, he has a good chance to get re-elected. Now, in the meanwhile, if a second wave hits and things are not dealt with appropriately,
Yes.
he might lose the election. But if economically we are sound at that time, most likely we will win, because people will forgive his personality if there is money in the bank.
Yes.
And that's what it comes down to in the general sense. So that's my thought in regards to his re-election.
So he is talking from the standpoint of what people in general feel. I will talk more from a personal standpoint, which includes
Yes.
all of our, like mine and his opinion too. I personally believe I am not specifically for a Republican or Democratic Party or Independent Party. However, when you look at a president, when you look at somebody who is in a leadership position, and this was a testing thing for him, he has not shown any signs of leadership, according to me. He has caused chaos. He has been more entertaining for the world and people in general than really helping them deal with this situation. He has given, he has lied again and again on the national and international media. He has put economy first in place of human lives. And for me
Yes.
personally, he shouldn't even be running for this presidency again. However, it's politics. And as Dr. Wade explains, people basically vote based on economy or what all. I don't really understand how you can how any party can even let this person run for a second term and represent them. So I don't know. I am not going to vote for him.
Continue with the same thing.
Yes.
Whenever the country faces a calamity, the leader or the king or whosoever it is, he should rule unanimously, make decisions unanimously for the well-being of each and every countryman, rather than choosing sides. And that just does not include the US, but all the countries in the world. He has been divisive in his words and actions, and right now he might win the election with his actions, because it's divide and rule politics, but it creates a deep divide in the long run, which can affect generations. and that affects the integrity of the country. And if people are not united, then those countries start falling apart, and other countries take advantage of that situation. So I would say if anybody who is a leader, he cannot choose between his subjects. He has to have a kind of a unanimous decision across the board, get both parties on board and make the correct decision and project confidence rather than fear when he's on the podium, which he has used, I think, for his re-election purpose. So.
So, moving on, you did touch on to the protest about reopening the economy. So, how did you react when you heard and saw the protests of people on the streets asking the United States government to open up the re-economy for claims that it's a violation of their human rights and their businesses are suffering and that it's more fear than practicality?
I would say we all talk about freedom all the time, like, freedom of this, freedom of that. But if there is freedom of everything, it does come at a cost. People can say anything. I think all the demonstrations were partly politically supported. Somebody was shooting from the hip. But at the same time, if you are a good politician, you need to listen to them too as to what their issues are and kind of sit them down on a table and ask them how can they be helped rather than resorting to this situation. But because of the deep divide, people are resorting to both sides now, either carrying guns around and approaching it and people opposing them. And that's why I would say all the leaders of both sides should unite in the fight against this and listen to all sides. There are some people who can afford sitting at home and able to get away without a job for 2 to 3 months. But most businesses have a hard time. They have to pay their mortgages, the people who they work for, the cook, and whatnot, and of course run their household too. And those are the businesses which are in trouble right now. And out of sheer frustration, some of them have even opened. There was one restaurant in California who they said if they wouldn't have opened, they would have had to shut down their operations within a month. They would have gone completely bankrupt. So I would say help from the government in a timely manner, in an efficient manner, would have been helpful. I think the software which is used to even apply for unemployment and help is kind of quite old. I think it's about 25 years old, and they don't even have enough. They don't even have enough programmers who know that language. So I would say a more advanced system in the most technologically advanced country in the world should have a better system to kind of get this thing going. And of course, other businesses took advantage of that. Those who have enough people to fill out their applications, lawyers and whatnot, they got millions and millions of dollars as a bailout in this situation. And after people came to know about that, they gave the money back. But the simple store at the corner of your street is struggling. And even just us personally, if I have to go buy stuff, I'm kind of backing off into buying certain things and waiting until things open up more. So I would say listen to both sides of the aisle. People are shooting from their hips, coming to demonstrations and just making it more political rather than making a united front in this whole situation. So
Answer that question. It is a bit tricky in terms of yes, I understand that there are people who rely on day-to-day earnings to at least bring food on the table. However, you have to understand that if you are alive, then you can earn. So if you are in a situation where it becomes imperative to save your life versus to go make a living, you have to any human will first try and save their own life, right? But here, going out to work, you are also putting other lives at risk as well. So So, what I would recommend is that at least trying to. I don't understand the political scenarios in terms of, as Dr. Wade mentioned, that it was politically driven, which I do agree. Bringing out guns for the demonstration is kind of a very, very political way of saying getting vote from gun supporting groups. However, when you look at, so by opening early, you are actually going to spread the disease more. There is more chance of getting more people sick and all overburdening the healthcare system.
Yes.
That is the reason why the lockdown is so important, which people don't understand. Trying to hurry or rush to open up businesses is going to create more trouble. We still have to understand that on one hand, the flu infection, influenza, has vaccine and treatment available. While we are still struggling to find appropriate treatment for this, we do not have that. As well as the vaccine is also in the process of being made. We don't still have it. So
Yes.
any pandemic requires patience. We caged up animals for years and years and years for our entertainment. That's how humans have been. So you have to now take responsibility for your fellow human beings, for your fellow species, and try and be more responsible and stay inside. On the other hand, this is where leadership counts, where the government can come up with better plans to help these people who are financially in trouble, rather than asking them to come out and do demonstrations affecting the health of other people and lives of other people.
Yes.
I hope that answered your question.
Yes, it did. Thank you. So, what do you say to those who don't really believe coronavirus is a risk and think the whole world and the international community is overreacting, or it's some kind of conspiracy to sort of change the whole dynamic of world politics?
So this is what I will say to them is it is definitely not a conspiracy. You have to understand that, CDC comes up with these numbers for, say, for instance, influenza virus. And each year, how many deaths happen from that. And they mark it from, say, for 1st of October till probably April of next year is the period that they take.
Yes.
And they estimate around like maybe 600,000 or some deaths. With coronavirus, just from the beginning of February till April, we have already reached that number, almost close to that.
Yes.
You see the data from all around the world. About 3.4 million cases of this virus has happened. So it is pretty much here. For somebody who thinks this is something of a hoax, then seriously, I don't know what their state of mind is. I am not trying to be rude, but they definitely are extremely ignorant, and they need to educate themselves better, is what I would say. I'm not being rude, and I'm not being, but it's just kind of so weird to really think of this as a hoax. It's very real. And working in the field, that's what you see every single day. That you do see coronavirus cases. It has been scientifically proven, so it's not a hoax.
Yes.
I'm going to correct some numbers which Dr. Bhatt said. The reason being, we have listened and read so many numbers that all the numbers are getting jumbled up in our brains. But the estimated death rate of influenza is about 389,000. So let's say 390,000. And that's not even reported. That's a calculated number. And that's across the world. The total number of deaths for corona for this year has reached about 240,000. And that is with isolation, by
Yes.
locking down the whole world pretty much. With influenza, we don't lock down. And after that, we have this many deaths. So imagine if we wouldn't have locked down the countries across the world, the death rate would have been immensely higher. Because when this one hits, you do get sick, and you do okay, and you are having some symptoms. But I've seen patients deteriorate right in front of my eyes, and within 5-6 hours they are on a ventilator, and before that they were just on a couple of liters of oxygen. So people who think it's a hoax, it's not a hoax, or it is a hoax until it hits them. And once it hits them, they realize, oh my God. And there are a lot of international, or I would say Instagram and YouTube personalities who were all saying, oh, this is a hoax and it's not going to come here. And those were the same people who got infected, including world leaders like Boris Johnson, the Prime Minister of UK. He didn't say it was a hoax, but he went around shaking hands, not wearing a mask, and he ended up in the hospital himself. And there are several other personalities in the US who had the same situation. So I would say it's definitely not a hoax, but I would say the government should pass on the correct messages, whether they are scary or not, but the correct messages should pass on from the government to the people, so they prep themselves properly rather than using the words hoax and stuff like that, because this is not fake news. This is real.
Thank you. And so, moving on, just to get an idea for some of the viewers here who don't really understand what it's like to be a doctor. So I wanted to ask, what is it like to work on the COVID floor? And how would you describe the experience so far?
Well, so far, before it hit us here, the preparation was quite scary. Just the thought of it, it's going to come here, and seeing how the other cities were dealing with it,
Yes.
we were just kind of scared, lost our sleep, lost our appetites, just thinking about it. And then finally hit here. And when we are going to work, it's like going to the battlefield, and we can't even see the enemy because the enemy is very tiny, but it's all over the place. And then you walk in, and then you see all these different emails coming in every day about the masks, and oh, we need to wear this, and then it gets downgraded. Oh, it should be fine. And we have gone down from N95s to level 3 masks, and sometimes to level 1 masks based on what's available. So even the information is kind of not correct, provided by administrators based on what they are learning. So even they are in a situation where they don't know what they're doing. But the trickiest part is once we go to work and once I'm on the floor, that is it. You don't think about all those things. You wear proper equipment, as much whatever is available, and you jump in and try to help the patients out and make sure we can heal them as much as we can and get them home. So that's the situation. I've seen that wearing all this protective equipment is easier, but taking it off is where the tricky part is, because that's where we end up touching things or the surfaces, and everybody has come up with their own ways of doing it to protect themselves. But I've seen a lot of people walking in and out of rooms wearing the same gowns, not even having time sometimes to clean them up properly, and it's assigned to them, but then they have to wear the same thing and go inside, and then they're touching the wrong surfaces of the gowns. Then they come out, touch the tables, and touch the nursing station, and touch the computers and everything. So in general, so emotionally it has been taxing, especially before we go to work and after we're done with work. But when we are on duty, it's like an army man or army personnel who is there, and they don't have time to think anything else except to make the best of that situation. The main worry is people who were in the forefront, especially in hotspots like New York and New Jersey and California and Washington, where they were hit pretty hard. The emotional toll which it will take afterwards. in general. But I see people stressed out, people talking about how the effects are going to be on the staff, not just the physicians, but nursing staff, nursing aides, cleaning staff, and everybody, the respiratory therapists who are involved in these things, and they are in and out of rooms quite often. You can see the stress on their face. And as being a worker of the medical field, we are not used to seeking attention that easily.
Yes.
As you have heard, the doctors and nurses are the worst patients. Uh, so I think making them get or seek medical attention or psychiatric help would be a good thing to do after this is over. Um, Otherwise, it might lead to some more loss of life and some PTSD, which is being expected once the epidemic is in check again. So
Yes.
that's my say in regards to the emotional impact what we are facing right now.
As a doctor, if you had the chance to, let's just say you made a worldwide stream, what would you say to people during the current COVID-19 pandemic?
I would say be home if you can. If financially you are able to handle the stress and emotional, just stay away from people. Keep things clean as much as you can. Of course, being in the same household with family members can be taxing too. So I would say throughout the day, walk away, go take a walk outside, breathe some fresh air, and then come in, and then sit down with your family and chat about other things. But I would say social distancing is a must in this whole situation. And if you have symptoms, seek medical attention right away and try to isolate yourself. I know they are saying 14 days, but there are some instances which they say you could still spread some virus around for 18 or 19 days, although more data will come out in the future about this. But I would say stay away from people, keep yourself emotionally healthy, exercise, eat healthy food, healthy diets, and as I said, walk outside and get some sun and air on your face and your hair. But of course, stay away from people while you are doing that. Even when you go out for a walk, if you see somebody approaching on the sidewalk, I would say get away from that a bit. Go on somebody's lawn and walk over there rather than crossing each other. So that would be my 2 cent advice for the world right now.
Yes.
I would say do definitely diligent hand washing, making sure that you take